Good morning and good afternoon. In our weekly session today, we are going to talk about Ayurvedic herbs that can help with GERD. Presenting this session, we have Dr. Pooja Kiran from Boston, and she is an Ayurvedic doctor with over 15 years of experience. Welcome, Dr. Pooja.
Thank you very much, Amita. So, and I would like to say hello to everyone, and I would like to welcome everyone in today's discussion on some Ayurvedic herbs that are helpful in treating and managing GERD. GERD, GERD, is the acronym for gastroesophageal reflux disease. GERD is a chronic digestive disorder. It is a condition where stomach acid regularly and persistently flows up into the esophagus, also called as the food pipe. It should not be confused with hyperacidity. Having occasional hyperacidity and acid reflux is more common and often does not need medical treatment. However, if a person suffers from acid reflux frequently, as much as 2 to 3 times in a week and persistently, then it could be an indication of GERD. And GERD is diagnosed by a physician or a health practitioner after proper evaluation of the signs and symptoms. GERD occurs when the sphincter or the natural constriction at the bottom of the esophagus becomes weak because of many reasons. I'm not going to implore all the reasons here, but the main symptom of GERD is consistent heartburn. Ayurveda classifies GERD under diseases caused due to Pitta imbalances. Some classics refer to it as Amla Pitta and others indicate it as Pitta-aggravating dosha, meaning disorders of the gastrointestinal system due to increased acid content or Pitta. The Ayurvedic protocol to treat GERD lies in bringing imbalanced Pitta back to equilibrium while maintaining a healthy Agni, which is the digestive fire, and repairing the damaged tissues of the gastrointestinal lining. And this is done by administering herbs and certain panchakarma treatments, such as vomiting therapy, purgation therapy, which are called Vamana and Virechana, as per the clinical evaluation and strength of the person. So today we will discuss some Ayurvedic herbs used in treating GERD. The first one we will talk about is PATOLA, which is Trichosanthus dioica. That's the botanical name. And the English name is pointed gourd. It is bitter in taste with a pungent after digestion taste, is hot in potency, is light and dry in nature. So these are the Ayurvedic pharmacological methods to actually understand the action or therapeutic action of the herb. So Patola, because of all these actions, Patola has Pitta and Kapha balancing effect. Just like I said, GERD is mainly because of Pitta imbalance. So the Pitta balancing effect definitely helps in controlling GERD. So generally Patola is a gastroprotective, it improves digestion and appetite, has anti-ulcerous effect and wound healing capacity, which helps in chronic and severe problems of GERD, which eventually lead to ulcers in the esophagus, gastric ulcers, and even duodenal ulcers. So this Patola has ulcerous effect and wound healing capacity, which again helps in managing and treating GERD. It has anti-inflammatory property, has laxative property, which helps in reducing the acid content or reduces the pitta from the system. And the laxative property helps in that way, and is shown to be effective in Amla Pitta cases or GERD cases. We have a lot of research as well done using Patola as a herb in combinations or formulations along with other herbs. Research has been done and it has been found effective in cases of GERD or Amla Pitta. The second herb, as you can see on the screen, is Nimba. The botanical name is Azadirachta indica. The English name is Margosa tree or Indian lilac. It's also commonly known as a neem tree. It is bitter and astringent in taste. It has a pungent after digestion taste, is cold in potency, and is light and dry in nature. Nimba again has Pitta and Kapha reducing effect. So it is a gastroprotective. It has anti-ulcer properties and inhibits acid secretion, thereby controlling the gastric hyperacidity, and has mucous membrane protective property. Again, in GERD, because of high acidic content from the stomach, the mucus lining of these the esophagus and the gastric the stomach gets eroded, and that causes more problems leading to GERD and ulcers. So Nimba has mucus lining protective property, so it helps in healing that mucus lining. The third herb is YASHTI Madhu. The botanical name is Glycyrrhiza glabra. The English name is Licorice. Everyone must be very familiar with licorice. It is sweet in taste, with sweet after digestion taste, is cold in potency, and is heavy and unctuous in nature. This gives Yashti or licorice the balancing of Vata and Pitta. So it actually mitigates or alleviates Vata and Pitta dosha, aggressive Vata and Pitta dosha. So this therapeutic action makes it act as an antacid, is laxative in nature, it reduces burning sensation, it has wound healing properties, and is a tonic in nature. It has a regenerative property as well. It helps regenerate tissues and linings. The fourth herb today that we would discuss is Draksha. The botanical name is Vitis vinifera. The English name is European wine grape. So it comes from the grape family. It has sweet and bitter taste with a sweet after digestion taste. It's cold in potency and is heavy and unctuous in nature. And again, all these properties makes it pacify Vata and Pitta dosha. It enhances digestion, is a laxative. It reduces burning sensation. And along with all this, it provides nourishment and strength. Most of the people who suffer from GERD will have a lot of weakness and fatigue because the digestive system itself, where the food is processed, is not working properly. So having the ojas or the strength of the patient reduces a lot. And Draksha is one herb that, apart from reducing Pitta and help treat GERD, it also provides nourishment and strength. So this is a very important herb. And the last one today that we would discuss is Shatavari. The botanical name is Asparagus racemosus. The English name is wild asparagus or climbing asparagus. It is sweet and bitter in taste with sweet after digestion taste, is again cold in potency, is heavy and unctuous in nature. This helps it mitigate Vata and Pitta. It improves digestion. It has laxative properties, has astringent properties, and provides strength. So I want to summarize what we understood from these five, the properties of these five herbs. Like all these herbs have one thing in common, that is bitter taste. As per the basic principles of Ayurveda, bitter taste pacifies Pitta while maintaining healthy Agni or digestion. And this helps in reducing the excessive acid secretion in the stomach without affecting the normal digestive activity. Also, some of the herbs have laxative effect. This helps in expelling the excessive Pitta by facilitating the downward movement of Pitta. And this helps in to control the upward reflux of the acid into the esophagus and helps in treating GERD. And some of the herbs have wound healing property that help to restore the damaged mucus lining of the stomach and esophagus and heals the ulcers caused due to chronic and pathological acidity. Definitely to undertake herbs for GERD, one must get a thorough evaluation from an Ayurvedic practitioner to get personalized advice based on individual clinical requirements. Along with herbs, one must also follow a strict diet and lifestyle pattern to keep GERD at bay. A holistic approach could give great relief in treating and managing GERD without much dependence on long-term synthetic drugs. Thank you.
So one question I wanted to ask, I see all these herbs are readily available. You know, you can go to Amazon, you can go a lot of vitamin stores. So, and the reason they're available is probably people are buying these off the shelf, I should say that. So is there any of the herb that is safe that one can take by themselves, or then you still recommend that they should consult with the proper Ayurvedic physician?
Certainly, these herbs are very safe to take. Like many of these herbs are just whole plant products. Like patola is actually a vegetable, very commonly taken by many people in their diet. Draksha is again a fruit. Grapes, wine grapes are very common. People take it in their diet as well. And other licorice again is a common food product that people take in their diet as well. And shatavari and neem, they again do not have many dangerous side effects as such. So taking them like off the shelf in the recommended dosage as is written on the package will not have any problems. If at all there are any allergies to some of these, like many people have food allergies, so because this is also part of the diet, some people might like it might not be suitable for them, but they will experience that as soon as they take it. Like even in the first dose, if something is allergic to them, they will get to know that. And these allergies are not life-threatening allergies. It could be like simple rashes or a simple indigestion or a headache. So definitely, like buying it over the counter from the right from the shelf is not a problem at all. And if it is to be taken for a specific condition like GERD, because it's a medical condition, it needs to be evaluated. Like the signs and symptoms need to be evaluated. So if someone is suffering from GERD, I would definitely suggest that they actually take an advice from a practitioner. But for general usage, even GERD patients can take these in their general diet as long as they feel comfortable with it after taking it. There shouldn't be any problem.
Sure, sure. And then there's always caution involved. Like you don't want to start taking all the 5 herbs, right? Maybe take one at a time or
It's
something
all
like that.
whenever someone has the intention to self-medicate, it's always best to start with one herb at a time and not like 5 6 herbs. Here I'm giving a list of herbs just for educative purposes, but if someone is interested in taking it for self-medication, take one herb at a time at the lowest dose and go gradually from there. See how it's effective, how much is it helping, and then slowly increase it to the highest dosage as per what is advised, and then increase more herbs into the regimen basically. Yeah.
Sure. Well, thank you, Dr. Pooja. And if anyone who's watching or watched this session at a later point, our emails are right here. Dr. Pooja also provides consultations on specifically on herbs, how to take them with your specific ailment. So you're welcome to reach out to us for if you needed any consultation or any other further questions. What we do is every Sunday we bring a new topic and we talk about Ayurvedic herbs for a different medical ailment. Let us know if there is any particular topic that you would like us to cover. We are open for all the suggestions. With that, I'd like to wrap up this session. Thank you so much, Dr. Pooja, for joining us on this beautiful Sunday afternoon.
Thank you very much.
Enjoy. Yeah, try to keep all of us peace with the rest of the day today. Thank you.
Thank you.